My name is Maxi Miciak, and during WCPT 2017, I presented on a topic very close to my heart, and that's my doctoral work on the therapeutic relationship in physical therapy. And during the presentation, I spoke about Chuck Nolan, the main character in Castaway, and how during this exceptionally distressing and vulnerable time in his life, he did something very human to get through it. He developed a relationship. Now, our patients will go through similar emotions, and the therapeutic relationship can be that anchor that helps them move forward in their rehabilitation. However, we're in our infancy in understanding the therapeutic relationship in physical therapy. We tend to borrow conceptual frameworks from other disciplines because we really don't have any concise frameworks of our own. And so my objective was to develop a physiotherapy specific conceptual framework. To do this, I did a qualitative study where I interviewed patients and therapists in private practice clinics in Edmonton, Alberta, Canada. And through that inductive and iterative process, I came up with a framework that consists of 3 key components. The conditions of engagement involve being present, receptive, committed, and genuine. When physical therapists establish connections with their patients, they do so by acknowledging the individual, giving of self, and using the body as a pivot point. And the bond that's created between patient and therapist, that positive affective attachment, is based on rapport, respect, trust, and caring. Now, taking those 3 components in combination with 3 themes that were common across those 3 components, I came up with a definition specific to physical therapy. And ultimately, I think there are some pretty interesting conclusions from the study. First of all, I found that there are characteristics of the therapeutic relationship specific to physio. So we can't borrow frameworks from other disciplines and assume they're going to cover what needs to be covered. There isn't one way to develop a relationship. The relationships that PTs do develop are grounded in professionalism, but there can be a personal dimension that really enriches the relationship. And finally, moving forward, we really need to operationalize frameworks in order to be able to translate this knowledge into clinical practice. And that's my doctoral work in about 2 minutes.